will talk about the future of the future, something beyond navigation. So let me introduce the concept of Metaverse and also the concept of artificial intelligence guided surgery. So we all know that we are in the third industrial revolution, so-called the revolution of information and communication. And this revolution has dramatically changed our daily life. As any industrial revolution, it has not a linear trend, but an exponential trend with booster. First booster was when I was a kid. It was the first computer at home, and I was playing with the first video games. And then we had a second booster. It was internet. It was in 2000. We had a third booster, the smartphone. It was in 2007, and by that time we had all our old Nokia or BlackBerry system, and we were wondering why a phone has no button, no touch. We realized that, in fact, the smartphone was much more than a phone, a cell phone. It was a real computer, and that's filled with plenty of application. And nowadays, we cannot live without our smartphone. I'm wondering if one of you has not his smartphone right now today. No, nobody. If one of you forgets his smartphone at home one morning, he will go back home and get it. It will not spend the day without his smartphone. And the current booster of this industrial revolution is artificial intelligence. It's less visible, but it's a fantastic booster, and now all our applications we use with our smartphone are full of artificial intelligence algorithms. So when I used first the mixed reality headset, it was in 2017, just 1 year after that Microsoft launched the first version, I thought it was perhaps the surgeon's smartphone. Because the only place where us surgeons, we do not have access to a smartphone, to a computer, to a tablet, it is during the surgery, because of course we are draped in a sterile mode and we cannot touch a button. But then, because the mixed reality headset is a real computer, and that this real computer has artificial intelligence sensor that allow you to interact with your computer by gesture or oral command. You saw this morning in the theater, I didn't touch anything. I just popped up on screens. I could press on buttons. I couldn't even press on a virtual keyboard. I do not touch anything. It could be the surgeon's smartphone. So the tools that make the surgeon enter into this revolution. So that's why the world premiere in 2017. By that time, I use holographic platform to get access to the 3D CT scan of the patient, but in fact it was a little bit equivalent to what we've seen this morning in the theater, except that also you have the capacity, because of the camera, to connect to, by that time, a Skype meeting, and I was connected to colleagues in UK, in US, and in South Korea, that were able to see exactly what I was doing because of the camera, and also that were able to interact with me. But beyond that, but nowadays it can connect a Teams meeting. So then I thought it was the little kids of what we call the computer-assisted orthopedic surgery. After navigation, planning software and PSA, robotics, then we had little kids called mixed reality, and we will be able to do some navigation with the mixed reality. It is probably the case. Lots of teams are working on it. There is still, for me, one big problem, which is the brightness of the cyclic of the surgical field, and you cannot really see the holographic view, so it's a little bit complex to overlap your holograms to the real body of the patient, so that the patient becomes transparent. But perhaps one day we will solve this issue. But I don't want to talk about that. I want to talk that this mixed reality or headset opened two new completely field. First field is an improvement in the field of tele-expertise, tele-assistance, and mentoring and education with the Metaverse collaboration. So in 2021, also there was the COVID pandemics in 2020, but we were able to get the second version of the HoloLens. The first version was promising, but the artificial sensor were not good enough to use it in routine practice. But then with the second version, it was much better. I'm not saying that it is perfect. Probably there will be a latest version. Remember that we are now at the iPhone 14, so I guess with the HoloLens 14 we will have a much more powerful device. But then with the second system, I thought, yes, this is a system that could be used anywhere in the world, not just in my teaching hospital where dedicated IT team. That's why I set up with Microsoft and Evolutis this event called the 24-hour of holographic surgery. Ashish performed a surgery here in India, and it makes quite a big, it raised a big interest. We had 15,000 of participants to this event from 130 countries. And after that, I asked the surgeons what was the applications they found the most useful in this technology. And they all answered, it's the collaborative aspect of the technology. So collaborative means what? So the fact that during the surgery you can connect to a Teams meeting, and then you can call for juniors to watch what you are doing, so it's interesting for training. You can also, if you encounter a problem, call for a more senior surgeon. And in my department, for a while, I asked my fellows to use the HoloLens so that they can call me in my office if they face any difficulty during the surgery. And then even if you do a complex case, for instance, of a revision for infection and arthroplasty, you can call the infectious disease specialist that see exactly what you see, and you can discuss of where to do samples and what antibiotics to provide next. But this is pushed to the next level, I think, with Metaverse. So what is Metaverse? It's a virtual reality space in which users can interact. And mixed reality and HoloLens can provide Metaverse system. I will show you. It's interesting for case discussion. Here, it's a Metaverse meeting performed from Briennon, so from south of France. And you can see I'm discussing, my avatar is discussing live with Steve Roche, who was in Cape Town, South Africa, Bruno Gobato, who was in Brazil, Jean-Florent Ciernoac, who was in Brussels. And it's possible to import in this Metaverse meeting some 3D elements, so some holograms, and of the patient, some image, of course, but also some 3D elements. And we were all in our office, but in our own office, we were with the avatar of the other participant. So you see how this could improve the collaboration in between people. And it's also very interesting in terms of education. This is another avatar meeting I've done with Jonathan Péguet. And you see, this model, it's even more relevant for education than a real 3D models, because you can enter into the model. You can cut it in all the plan you want. So the future is probably that. It will be pushed away when Microsoft will launch its own Metaverse application that will be linked with Teams. So, just briefly, artificial intelligence guided surgery. This is, I believe, really the future of the future. I've created a dedicated research team in my university to do that. What it is roughly, as soon as you've got a system that can capture some image of the surgery, process the image and restitute the data in real time to the surgeon, then you open a new area. I will show some example. So that's how artificial intelligence is changing dramatically medical care. This application is called Glimmer in all university hospital of Paris and Paris area. If you go to the emergency for a suspicion of fracture, you get an X-ray, and all the X-ray will be analyzed by an artificial intelligence algorithm that will put a square around what he feels is a fracture, and it becoming amazingly performant. And nowadays there is almost no fracture that are not seen at the emergency. So the idea is the same, and that's what we've done. We've taught an algorithm to detect the microstructure of the hand, and he was able. So the algorithm was able to detect artery, nerve, tendon by up to 70 to 90% of the case. But more than detecting, it can also visualize and analyze the whole structure. That's another algorithm we teach to analyze the different structure of shoulder arthroscopy. And for instance, this is the longer head of biceps. And that's what the algorithm does. In real time, is capable to see and to contour all the long head of biceps. So it looks like ridiculous, but you can imagine that the possibilities are unlimited. And after the normal structure, it will be able to detect the abnormal structure. It will be detect to classify the abnormal structure. It will be able to visualize some very rare anatomic variation. So unless working with your own experience, you might work with the experience of thousands of hundreds of surgeons, because you will have a system that will analyze in real time the image, process the image with the experience of thousands of hundreds of surgeons, and restitute the data in real time. Thank you.